Good afternoon, everyone. Thank you all for joining us for today's webinar. We'll get started in just another minute or so to give everyone a chance to join. All right, good afternoon, everyone. Thank you so much again for joining us for today's webinar. Today, our topic is coping and working with cancer. My name is Anna Tan, and I am the WorkWell Program Coordinator for WorkWell NYC. Before we get started, I'd like to share with you all a little bit about WorkWell NYC. WorkWell NYC is a worksite wellness program for City of New York employees, and our mission is for all employees to live as healthily and well as possible. We operate in 5 key program areas as seen here. We have Move More, which focuses on physical activity. We have Eat Well, which targets healthy eating and nutrition. We have Take Action, which focuses on primary care and prevention. And of course, we have Be Well, which focuses on mental well-being and resilience. And lastly, we have Project Build, which stands for Building Understanding, Inclusion, Learning, and Diversity, and that is our health equity initiative. In today's session, we will be covering the following. We will explore the connection between mental health and cancer survivorship. We will bring awareness to cancer disparities, deliver strategies on how to manage cancer treatment at work, and provide tips on supporting coworkers with cancer. And now I will turn it over to Marley Keel from CancerCare to introduce herself.
Hello, everybody. Thank you, Anna, and thank you all for having me today. My name is Marley, and I am a licensed oncology social worker and the young adult program manager at CancerCare. I've been with CancerCare for about 5 years now, and I've had the privilege of working with individuals with all different diagnoses and different populations. But I really do have a passion for working with young adults between the ages of 20 and 39. So again, I want to thank you all for having me today. And before I get started, I do want to let you all know I've had an ongoing cold for about 2 weeks now that has been relentless. So please bear with me if you notice me sniffling or coughing during the presentation. So thank you. So before we really dive in, we wanted to do a quick poll just to get an idea of who is in the audience today. So whether you're somebody that's actively living with cancer, or maybe you know somebody that's living with cancer, or maybe neither. And of course, this is completely anonymous. Great. Thank you, everybody. Thank you. Definitely gives us a good idea of who is in the audience today. We appreciate you taking the time. All right, so I wanted to start with just some quick facts about cancer in New York City. So cancer is the second leading cause of death, killing about 12,500 residents each year. It is also the leading cause of death among people younger than 65. So I know that, when you think of cancer, automatically you think about older adults or elderly individuals. But of course, as a young adult program manager, I see every day that younger individuals are greatly impacted by cancer. And unfortunately, it is the leading cause of death among people younger than 65. The most common types of cancer are skin, breast, prostate, lung, and colon or colorectal cancer. So I wanted to take some time to talk a little bit about disparities in cancer care. So as we know, cancer does not discriminate, and everyone is impacted by cancer. However, there are some specific racial and ethnic groups that are impacted more significantly than others. So I wanted to share some facts about that. So Latinos have a higher chance of being diagnosed with stomach cancer, liver, cervical, and gallbladder cancer. American Indians and Alaska Natives have a higher death rate from kidney cancer. LGBTQ plus individuals have a higher rate of being diagnosed with certain cancers and at a later start date, so later diagnosis time. And unfortunately, Black individuals have a higher cancer death rate and the shortest survival rate of all racial groups. So you might ask, what is the cause of these disparities in healthcare? So unfortunately, we do see that a lot of these disparities are a result of racism and discrimination within the healthcare field. Another common cause is those that are impacted by poverty or have a lower income than others. So those that live in low income communities, we're seeing that there is a lack of screening information, lack of educational resources, community resources on cancer prevention and screenings. They might have decreased access to care. And a lot of times we are seeing language barriers within the healthcare system. So a lot of information is being lost in communication, and a lot of individuals aren't able to truly understand to the extent that they need to make sure that they're getting the care that they deserve. So these are some of the reasons why we're seeing a lot of these disparities within cancer care. And of course, it's something that, within the healthcare field is constantly looked at and hopefully is improving. But it is very difficult to see these disparities. So caring for your mental health and cancer. So we'll talk a little bit more specifically about mental health in these next couple slides. So, of course, it is impossible to predict how you'll feel when you hear the words you have cancer. And before I start, I want to say that however you feel in that moment is completely valid and completely an individualized experience. There is no right or wrong response when being told that you have cancer. But some of the most common things that we hear from our clients when they have the initial thoughts come to their mind, they might ask themselves, how did I get cancer? What caused it? Did I cause cancer for myself? For example, we hear this a lot from individuals that might have smoked in the past, or maybe they might have put off being seen by a doctor when they realized something was wrong. They might ask, how should I tell my family, friends, and employer? Disclosure is a big cause of stress when being diagnosed with cancer. Why me? Am I going to die? This is a very common thought that comes up, trying to determine why this happened to you. And can I afford treatment? Of course, the financial factor is such a great stressor among the clients that we speak to. And for many, they're not sure how they're going to be able to afford undergoing treatment or keeping up with their doctor's visits, or all of the other logistics that come with managing a cancer diagnosis, transportation, specific diets. There's so many things that can come up. And again, these are just some of the common things that we hear, but whatever comes up for you is valid. So cancer and mental health. Up to 1 in 3 people treated for cancer have a mental health condition. So we typically see depression and anxiety within the clientele that we work with. A lot of people actually experience increased depression and anxiety after completing treatment, which isn't something that many people expect. A lot of people think that when being diagnosed with cancer, the anxiety and depression hits instantly, which it can, and it varies based on the individual. But a lot of times, the individuals, while they're in treatment, are so focused on getting through that treatment. All of their time, all of their energy goes into making sure that they are getting the care that they need. They're busy going to doctor's appointments. They simply just might not be feeling well. So they don't have the energy or the time or space to fully process what they're going through or what they've been through until after completing treatment. So we actually see a lot of times at CancerCare, individuals are seeking counseling or support after actually completing treatment once they have the time and space to actually put in that kind of work and attention. Treating mental health conditions while living with cancer can actually improve survival rates. So we do always encourage that, when you're newly diagnosed with cancer, you do seek some kind of support and you do not wait until after completing treatment, whether that is starting individual counseling or maybe even joining a patient support group to connect with other individuals that are navigating similar challenges and emotions. So strategies for keeping your mental health care in check. So I really encourage checking in with your emotions. It is so important to check in with yourself and ask yourself how you're doing. So a lot of times I will suggest to clients doing maybe a morning or before bed journal or check in with yourself to see how you're doing in that day. It's so essential to make sure that you're addressing whatever emotions come up for you. And I know it can be very difficult to sit with uncomfortable emotions, but it is so important. I often say that we are like pressure cookers, and if we let our emotions sit for too long, eventually they're going to explode. So it's so important to check in and ask yourself how you're feeling. Come up with a routine to do so. So again, whether that's morning or evening check-ins, maybe you designate a time once a week to give yourself the space to check in about how you're feeling. Whatever works for you. Seek professional support. So as I mentioned in the previous slide, that might be individual counseling, support groups, or peer mentorship. Individual counseling is great to have an outlet and a space just for you to process any emotions or feelings that come up, good and bad. A lot of times we feel we can't necessarily fully rely on our support systems because we want to protect them. Maybe we want to censor what we're sharing with them. So having a space where you can be brutally honest about what you're going through goes such a long way. Joining a support group is also incredibly helpful. So this can reduce feelings of isolation that might come up, and it gives you a chance to connect with other individuals that are navigating similar challenges and emotions, a chance to learn from each other, give support, and receive support yourself. And this, again, can truly go a long way because it can be a very lonely experience when it feels like nobody within your support system really can truly understand what you're going through. Another option is peer mentorship. So maybe you do want to connect with other individuals, but maybe a group is too much for you at this time. So peer mentorship is actually when you can actually connect with an individual that has been diagnosed with the same type of cancer and has as close to the same treatment plan as you. So you can connect with them on a one-on-one basis, whether that's by email, by phone, how often as you'd like. So this is a more flexible option. But really, self-care is whatever, fits your lifestyle and what works for you. There's no right or wrong when it comes to self-care in that way. So that might be going for walks or exercising, maybe getting together with friends. Maybe it's even just dedicating an hour or a half hour, 15 minutes to have a cup of tea in the morning or before bed. So really, again, self-care is individualized and it varies on the individual, but as long as you're carving out some time for you to focus on yourself, to check in with yourself and give your feelings and emotions the attention they deserve, that is the most important thing. So utilizing your support system. Of course, it is not always easy to ask for help. I can completely understand that. However, cancer diagnosis is not something that anybody should go through and not something that anyone should go through alone. So definitely, I encourage you to ask for help, you absolutely deserve the support. When looking at your support system, you really want to lean on those that you can trust to follow through with your requests. So ask yourself, who are the individuals within my support system that I can really rely on, that I can really count on when I need them? Maybe there's a specific person in your support system that you want to turn to when you just need to talk or vent or talk about the hard things. Or maybe there is somebody that you can go to when you don't want to talk about cancer at all. So identifying who's in your support system, how can they be supportive to you when you need them, and making sure that they are trustworthy. And of course, having a support system, a large support system, is wonderful. But with that being said, it can also be very overwhelming to be managing such a large support system. And this is all coming from a place of love, but people might be constantly reaching out to ask for treatment updates, to ask how you're doing, ask how they can be the most supportive. So again, while this is so appreciated, sometimes it's really just an extra task for the person with cancer to manage. So assigning somebody within your support system to be your point person can actually go a long way. So if there are specific questions that people are asking that you don't really want to constantly answer yourself, for example, treatment updates, maybe that's something that you can direct those within your the outer circles of your support system to reach out to this one person, and they can answer those questions on your behalf. So that is a technique that I've heard from many clients has been very useful, because again, it can be exhausting constantly talking about your diagnosis. So CancerCare actually has a tool that helps with exactly this. So it is actually a free online tool that allows patients or caregivers to share treatment updates, tasks that require some extra help or support, schedules, and fundraisers. So as you can see, there's a little image of what the care calendar would look like. So this is great for, for example, maybe you need help when it comes to chores. So in the calendar, you can put, okay, on Mondays, my neighbor is going to be picking up groceries for me. On Wednesdays, my relative is going to be picking up my kids from school. And on Fridays, somebody is going to help with yard work. So this is a way for members within your support system to see what's being taken care of and what they can help out with without actually asking the person with cancer, maybe the point person directly. As you can see in the description, you can also post treatment updates on here, any kind of fundraisers you might be having. So this is great for, again, it's all out of love, but it can be very exhausting constantly sharing the same updates, especially if they're a little bit more difficult of updates where, they're hard to talk about. So being able to post them in one space where those that are interested can go ahead and take a look without reaching out to you can be really helpful and take off some of that pressure that the person with cancer and those within the inner circle of the support system, can take that off of them. So before we move to the second half of the presentation, I did want to take a moment to share a quick grounding technique with you called the 5-4-3-2-1 grounding technique. So of course, there's no pressure to participate in this technique right now in this exercise, but it is very helpful in really anchoring you down when there's so many stressors happening, particularly if you are diagnosed with cancer or you have a loved one that's diagnosed with cancer. So of course, when diagnosed or you have a loved one that's diagnosed with cancer, it's so easy to jump to conclusions or find yourself really focusing on the stressors that are coming up for you. So again, this really helps, grounding techniques, and this one in particular really helps anchor you to reality and brings you back to the present when you find yourself having a hard time getting out of that space of uncertainty and the unknowns and maybe spiraling to worst case scenarios. So if you are able to, I would love for you to sit wherever you're sitting right now in a chair, maybe on at your desk or maybe on the sofa, depending on where you are if you're working from home, and really try to focus just on the words I am sharing. So again, this is called the 5-4-3-2-1 grounding technique. The goal is to shift your focus to the present moment by naming out loud things around you. So you are going to name 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. First, find somewhere that you can sit comfortably and take a moment to observe your surroundings. Now, out loud, name 5 things you can see. It can be a window, a bird, a cup of coffee, any 5 things around you. Next, name 4 things you can feel. Maybe it's your arms in your lap, your back against the chair, or your feet on the floor. Name 3 things you can hear. Is it the hum of the refrigerator, a car passing by outside, or music in another room? Now, name 2 things you can smell. It might be your laundry detergent, an air freshener, or the scent of soap from when you last washed your hands. What do you smell? And finally, name 1 thing you can taste. Perhaps this morning's coffee or something sweet. All right. Thank you all for participating that if you did. And I hope you found that helpful. And again, this is really an exercise meant to ground you in reality in the present, help you connect with what's happening in the current moment. Because again, if you are diagnosed with cancer or you have a loved one diagnosed with cancer, sometimes it's so easy to jump to conclusions or find yourself focusing on the what ifs. And this is a great technique to really bring you back to reality and the present moment. So thank you. And I would love to hear what you thought of that, or if maybe you've done anything similar in the chat box or during the Q&A. So for the next part of the presentation, we're going to talk about managing cancer treatment at work and caring for a colleague or coworker with cancer. So challenges with cancer and the workplace. So unfortunately, there are so many individuals that do not have the luxury of taking complete time off from work when they are diagnosed with cancer and undergoing treatment. So this can actually cause a lot of anxiety. You might feel anxious about how treatment and side effects are going to impact your ability to do your job. You might fear workplace discrimination. There are a lot of employers that aren't accommodating when an individual discloses that they are diagnosed with cancer. So, this is a very big concern, especially if you need your health insurance in order to get treatment. You might ask, how in the world am I going to balance my personal life, work, and cancer treatment? As we know, life does not stop when you're diagnosed with cancer. So, figuring out how you're going to manage everything, your everyday responsibilities, your work responsibilities, and treatment and doctor's appointments can be so overwhelming. And people don't always realize that cancer is a full time job in itself. So, it is a lot to navigate. And of course, scheduling treatment amount around your work hours. Is your job going to be flexible and work with you and making sure that you can accommodate your treatment schedule? So when you're talking to your doctor, if you know off the bat that working while in treatment is something that you're going to have to do, it should be an ongoing conversation with your doctor to let them know what kind of accommodations you might need, how your treatment might impact your ability to do your job, scheduling. So when you're talking about your treatment plan, asking them directly, what side effects will I have and will it impact my ability to work? So, for example, you might experience nausea or fatigue as a result of your treatment. Are there certain medications that you can take during their workday to offset those side effects? Or maybe if you have to take a specific drug that causes you to feel nauseous, can you potentially take that in the evening as opposed to the mornings? So, working with your doctor to figure out a treatment plan that will cause minimal side effects and will, allow you to really do your job during your work hours. Creating a treatment schedule that works with your hours. So for example, let's say maybe you need daily radiation treatment. Is it an option to do your radiation before work or maybe after work? Determining how you can best manage your side effects during work hours, as I discussed. So again, this should be an ongoing conversation with your doctor and your medical team to make sure that this is being taken care of and that you can work to your best ability while receiving cancer treatment. So, bringing this up in your very first appointment with your doctor, and as you go through treatment to make sure that you can continue to maintain this stability. So, reasonable accommodation. So, this means any change in the workplace or the way things are done that enables an individual with a disability or other medical needs to enjoy equal employment opportunities. So, for example, this means if you do decide to disclose to your employers, you are allowed certain accommodations. So that might mean flexible work hours to accommodate your treatment schedule, working remotely, which luckily due to COVID, many of us have been able to do and has been a great help when it comes to managing your treatment schedule. Attending meetings remotely, maybe adjusting office temperatures or taking a couple minutes to take a call from your doctor. So these are some things that would be available to you if you request a reasonable accommodation. So if you're interested in something like this, it's so important to have a conversation with your manager, your HR representative, anybody that is essential in getting this process started. So disclosing at the workplace, I want to start by saying there is no law saying that you do have to disclose at the workplace. However, if you decide not to, certain accommodations, as we discussed in the previous slide, might not be available to you. So it's really important to know that ahead of time when making your decision on if you want to, disclose at work or not. So if you do decide to disclose, you want to ask yourself who really needs to know. So maybe you want to start by only telling HR. So that would be a great start. This way you can get the accommodation process started. Or maybe you decide you want to tell some coworkers. So maybe you choose a handful of coworkers that you feel comfortable with to have that conversation. And a lot of people, decide maybe they don't want to tell anybody aside for HR that they have cancer. And this can be because a lot of individuals actually see the workplace as an escape from cancer, which typically tends to overtake every other aspect of their life. So for a lot of people, they might decide I will tell HR so they will be aware, but I'm not going to tell any of my colleagues what I am currently going through so I can have this as a sense of normalcy. There are other people that decide, they want to really expand their support system, their support network in every area possible. So maybe they want to tell everybody. And there's no right or wrong here. You should tell who you feel comfortable with when you feel comfortable sharing. And when it comes to disclosure, it's really one of the only things that individuals with cancer have control over. Of course, you don't have control over being diagnosed with cancer, but you have the right to decide who you want to tell about your diagnosis and when. So again, remember, disclosure is completely individualized. And I would hope that if you do decide to disclose to your employer, that they are incredibly understanding, accommodating, and do their best to work with you. So supporting a coworker with cancer. So how to be supportive. It can be incredibly overwhelming to think of how you should or can support a coworker with cancer. You want to make sure that you're offering the right things, you're saying the right things, and this can be overwhelming and intimidating. So a lot of the times I suggest being direct. Ask them directly, how can you be the most supportive to them? And typically they'll appreciate that, as opposed to being offered things that you might not be able to follow through with, or, giving them a list of things to choose from. Sometimes just asking them directly eliminates them having to decide how, within a large things that you're offering, what would be the most helpful. So directly asking them, how can I be a support to you? And making sure that you are offering something that you can actually follow through with. So that might mean bringing lunch or dinner to work for them, maybe giving them a ride to work or home from work. So again, being specific in what you're offering and making sure that you're offering something that, you can actually follow through with. Respecting their boundaries is incredibly important. So, although they might have disclosed to you that they might not want to talk about cancer during work hours, again, many people do find work to be an escape from their diagnosis. So, respecting their boundaries and really paying attention to the cues that they are putting out there. So, maybe asking them first, is this a good time to ask how you're doing? Do you want to talk about how you're doing or your diagnosis? And if they say no, respecting that. And if they say yes, being there to listen and offer that support that they need from you in that moment. Maybe you can offer to be a point person at work or to reduce their work strain. So if your, role offers that, maybe taking some assignments or tasks off their hands when possible to just reduce some of that work stress that they might be feeling. And don't underestimate the power of a card or a thoughtful note. Something as little as that really, really goes a long way. And of course, respecting cultural diversity. Everyone's cultural backgrounds, beliefs, values, and traditions can impact how they make decisions about their cancer treatment and care. So, being respectful of that is so, so important. And remembering everybody handles their diagnosis and treatment in their own unique individualized way. And we want to respect their decision and how they're navigating their own diagnosis, just as you would hope that they would also respect the decisions that you make. And we'll just talk a little bit about some resources, specifically CancerCare. So, of course, as you know, I work at CancerCare, and at CancerCare, we offer a variety of services. So, in regards to financial assistance, we do offer limited financial assistance if you are in active treatment, which can be used towards the cost of transportation to assist with traveling back and forth to treatment, as well as home care or child care if either of those are needed. And we also offer copay assistance to help with the cost of treatment, which insurance does not cover. So, of course, these grants depend on what funding is available, but definitely worth checking into if that's something that you are interested in. And we also offer a wide range of emotional support services as well. So, we do have individual counseling. get provided by our licensed oncology social workers. We have support groups that are all done virtually over Zoom at this time. We have online support groups, and we have tons of different publications on a variety of topics, some being cancer specific, some more general, available for free on our website. And we also have tons of different educational workshops and community resources available as well. So if you or a loved one has been impacted by cancer in any way, feel free to contact us at any time. We actually have a hope line that is staffed by our oncology social workers, and you can call to speak with an oncology social worker Monday through Friday. We are open 10 to 6 Monday through Thursday and 10 to 5 on Fridays.
All right, thank you very much, Marley. Just as a reminder, I do want to highlight that the webinar recording and slides from this presentation will be shared with you all afterwards. And in addition to that, the publications that Marley mentioned will have the link to access those publications on their website shared as well. So please be sure to browse all the great resources that CancerCare has to offer on their website. So now I'm going to talk a little bit about some resources available specifically to city employees. One of them is the New York City Employee Assistance Program, otherwise known as EAP. So EAP is a really great resource in that they provide education, information, counseling, and individualized referrals to assist with a wide range of personal and social difficulties. And I just want to highlight that EAP is available not only for city employees, but for their dependents as well. And if you visit their website, they also have a number of support groups, various groups at different times of the day to join in case that is something that you're interested in. And the contact information for EAP is listed here as well. Another resource is the Health Benefits program. So of course, navigating health insurance or financial resources for treatment can be quite challenging. So if you have any questions about your health plan or any of your health benefits, please be sure to reach out to the Health Benefits program. Their website and email is shown here on the slide. So now we have some time for Q&A. If anyone has any questions, you should be able to use the Q&A button on the screen. You can click that and type in your question, and then we will be able to spend some time to answer those. And I see there's a question in the chat about needing to be in active treatment to access individual counseling. For EAP, anyone who is a city employee can access the services provided by EAP. And Marley, could you speak a little bit more about the CancerCare counseling that might be available?
Yes, you beat me to it. I just saw that in the chat. And I wanted to briefly thank you all for writing in the chat throughout the presentation. I so appreciate you sharing your stories and your experiences. But in regards to CancerCare's financial assistance, yes, you do have to be in active treatment, whether that's chemo or radiation, in order to apply for our financial assistance.
So Marley, I see in the chat, there's another question. How long should it take to have an appointment if being told you have cancer?
Sure. So of course that varies based on what hospitals you're looking at. I do know that some have availability quicker than others, but really I would say as soon as you are told to try and get the soonest appointment that you can, just so you can start that process of meeting your medical team and getting the treatment plan sorted out, because it does take time between when you're actually diagnosed to actually starting treatment. If you need certain tests or have to have certain scans done, there might be insurance things that come up. And you also might want to get a second opinion, which is something I didn't talk about in the presentation, but I always, always, always suggest getting a second opinion. Even if you really love the first doctor that you meet with, it's really helpful to get a second opinion, really just to make sure that you did your due diligence, you explored your options, and this can really help just controlling when it comes to the lack of control in the overall situation. Knowing that you explored all options can really go a long way. But when it comes to the specific timeline, it does vary, but I would say to try and get the soonest appointment possible.
All right, thank you, Marley.
Yeah.
Another question earlier in the chat about MRIs versus mammograms for detecting breast cancer. Marley, do you know, is there any guidance on what might be a better tool for breast cancer diagnosis?
So I'm not totally, I'm not 100% on that, but I will say that CancerCare actually has a time to screen line on our helpline that you can actually call to be connected with and to get information on cancer screening. So that would definitely be a question that you could call and ask and get more information about prevention, screenings, mammograms, things of that nature. I do know that typically mammograms are utilized initially, but I don't want to speak too much on it because it's a little bit beyond my area of expertise. But absolutely call our helpline and request to be connected with the time to screen line, and they can definitely give you all the information that you're looking for.
All right. And for our next question, we have someone who asked, how can you support someone who will have or have had surgery?
Yeah, sure. So, in regards to financial assistance, if you are planning to have surgery, we do consider that active treatment. I'm sorry, I left that out earlier. So, that's definitely something when it comes to our transportation, home care, child care grant, you can call to inquire about. And also, in regards to our support services, again, we consider that active treatment as well. So, you would be eligible for all of those services, whether it's individual counseling, a support group, all of those great services that we have.
All right, and then we have a question here. Is there a way to get support to ask for a change of career and funding to steer away from career that is too close to your cancer? Perhaps the person who asked this question could elaborate a little bit more. I'm not totally sure, but it sounds like essentially this question is asking how to find support for a career change while navigating cancer treatment.
Yeah, sure. I mean, it is very, of course, overwhelming to think about changing a career at any point, but especially when navigating a cancer diagnosis. So something that I would recommend doing is definitely, exploring what professional support options are available to you. So that might be individual counseling to really weigh your options and see, what is available, the pros and cons of switching jobs, and really making sure you're prioritizing what's best for you. There are also a ton of services out there. For example, there's an organization called Cancer and Careers that offers great support in this area, or even working with a career advisor to see what would be the best fit for you. But I know obviously a big question to ask is, when it comes to insurance coverage, and if you are deciding to switch careers while in treatment, finding a new job that will also allow you to have insurance and that will continuously cover your treatment. So there's definitely a lot involved in this question. I hope that is helpful to a degree, but I would definitely recommend, connecting with a professional, whether that's an oncology social worker, a career advisor, or both, to see what your options are and the way to do that switch while maintaining your insurance and not interrupting your treatment plan.
All right, that's very helpful, Marley.
Yeah.
And so another question that I was wondering about is if there is someone who has been diagnosed with cancer or is undergoing treatment, if they seem that they could really benefit from receiving some kind of professional mental health support. And if they're resistant to that idea, what are some ways to maybe still support or maybe kind of encourage that person to get help that they might need?
Yeah, that's a great question. And I wish that there was a concrete answer to that kind of question. But of course, as many of us know, it really is the person who is going through the challenge. It's their decision at the end of the day to pursue that treatment or to pursue that professional support, even if we know, and maybe even they know that is the best thing for them. But until they're ready, that's really when, they should take that step. But with that being said, as somebody within their support system, the best thing that you can do is provide them with the resources and tools that they need to make that decision. So letting them know what support systems are out there, letting them know that you can be the one to take that first step and to help them make that first step. Asking them what would be helpful in getting them to a place where they feel ready to make that leap. So I think by doing that, letting them know what's available, how they can access the support, how you can help if maybe it feels too overwhelming to make that first initial call, and letting them know that you are there for them, I think really at the end of the day is all that you can do, because it really is their decision to make. And if they're not ready to take that step, the counseling won't really be helpful to the degree that, we want it to be. So again, doing what you can as a member of their support system to let them know what's out there so they don't have to do that research themselves, and really asking them, what can you do to help this process, develop?
All right. And so I know that we talked a little bit about disclosing a cancer diagnosis to employers, but if someone is, kind of trying to figure out who they should disclose or notify first, do you have any guidance on that, who they might disclose their diagnosis to?
Yeah, of course. So I think ultimately, asking themselves, is this something that they want to disclose to their employer, knowing the benefits and the risks of disclosing or not disclosing, and deciding what the best option is for them. So if they feel they do want certain accommodations, disclosing to your employer, whether that's your manager, your supervisor, whoever you feel most comfortable with that would need to know, starting with them and going to HR together, or maybe going to HR first if you feel you want to start with just getting the details, the logistics in order, reading the fine print, starting with HR first. Or maybe, before you even decide to disclose to your employer directly, you want to ask yourself, do I want some support from a coworker and a colleague first to hear their opinion? So maybe starting with somebody, a coworker, a colleague that you're closest with, and letting them know what you're going through, and maybe asking for support or their opinion on what you should do. So really, it is so individualized. Disclosure really, varies based on person to person. But again, asking yourself, who is the most important for me to tell right now, and how will it impact my, ability to do my job moving forward? So if I need these accommodations, maybe starting with HR or your supervisor or manager would be the best first person to go to.
All right, thank you for that, Marley. So another question is, when supporting a coworker, is there any guidance about language or ways to talk about a cancer diagnosis with someone who is undergoing treatment? I'm not sure if maybe, talking about using some words might feel a little bit more offensive versus using other language. Is there anything that you can speak to on that?
Yeah, well, I think when it comes to, and I think somebody, um, mention this in the chat, but I think somebody wrote, cancer isn't a death sentence. And I think a lot of times when somebody is diagnosed with cancer, of course, we want to be supportive. And our first instinct is to say, to look at them with very sorry eyes and say, I'm so sorry, something along those lines. But I think that kind of takes away from the person with cancer's narrative. So maybe approaching it by asking them, how are you doing? Seeing how they respond, how they talk about their diagnosis, and really picking up on their cues is great indicator on how you should be talking to them about their diagnosis. And I think I mentioned this earlier, but even being direct and asking how you can be the most supportive, not necessarily tiptoeing around it, but asking them, how can I be the best support to you right now? And sometimes it's okay to say, I don't know what to say. I wish there was something I can say, or I wish there was something I can do here. Sometimes it's okay to say something like that, or to have moments of silence even, and to sit with that silence. And of course, always encouraging them to take care of themselves. At the end of the day, that is the most important thing.
That's very helpful. Thank you, Marley.
Yeah.
So we have another question about finding a plastic surgeon, especially since there may be scarring and side effects after treatment, and also just in terms of how someone might view their own body. Do you have any resources or something that you could point this person towards?
Yeah, of course. So unfortunately at CancerCare, we're not able to give direct referrals, but what I would recommend doing is connecting with the surgeon that did your first surgery, or or your oncologist, to see if they have any direct referrals. There's also an organization called the National Cancer Institute, and you can also get referrals through them as well.
All right, well, there's been a lot of really great questions today, and I see in the chat there are several people who are either cancer survivors or who have recently received a cancer diagnosis. And I want to say, we are all here to support you along your journey, no matter where you are. Thank you so much for joining us, and we really hope that this information has been very helpful for you all. So we just have more things before we wrap up for today. So we just have a quick poll, a few quick polls. So first, we just want to hear from you all, and of course the poll is anonymous. This webinar increased my overall knowledge about this topic, yes or no. So if you can just take a few moments to respond to that poll, that would be really appreciated. We're always trying to improve our programs and resources here at WorkWell NYC. So any feedback that you have is really appreciated. So I'm happy to see that most people feel that they did learn something new from today's presentation. And if you did not, that's okay. If you have any more specific feedback, we would definitely love to hear from you. Please feel free to send us an email at workwell@olr.nyc.gov. And then just one more poll. So here we just, again, want to hear about the quality of the webinar. How would you rate this webinar? Poor, fair, good, very good, or excellent? And again, your response is anonymous. All right, so thank you all for responding to the poll. So I just want to highlight a few upcoming events before we wrap up. We have next month on November 17th, Diabetes Doesn't Define Me, a live Q&A. So come to that event with your questions about diabetes. We'll have an expert there to talk about the topic and answer any questions that you all might have. We also have the bi-weekly COVID-19 briefing for city workers. Those happen on Thursdays at 12. And for anyone who is really interested in up-to-date information about COVID and the number of cases, or even any new questions about COVID, please feel free to register and join us for that. Links to register for any of these events can be found at on.nyc.gov/upcoming events. And of course, it is flu season, so we always encourage everyone who can to get their flu shots. You can visit on.nyc.gov/WWNYC-flu to see if there is a flu clinic at your work site or maybe at another city agency that is close by to where you work. So please, we have COVID, we have flu, anything you can to protect yourself to stay healthy. We really encourage you to take that step to protect yourself. And lastly, we invite you to contact us. Again, as I mentioned, if you have any specific feedback about this webinar that you'd like to share, you can send us an email at workwell@oor.nyc.gov. Our website is also shown here. You can navigate to our website to find information about upcoming events and any sort of additional resources, whether it's for mental health and resilience or for any other aspect of health. And of course, we invite you all to connect with us on Instagram at WorkWell NYC or on LinkedIn as well. So thank you all so much for joining us for today. Thank you, Marley. There was a lot of really great information. I know that I learned a lot of new stuff from this presentation. And for all of you who've joined us today, thank you for attending. Again, as a reminder, the recording and the slides will be shared with y'all afterwards. So we hope that these resources are helpful and looking forward to seeing you all at a future WorkWell NYC event.